Well, hello there, future nurses. Welcome back to Med Monday. I'm so glad you're here today. We're going to get this done in under 5 minutes, but I do want to remind you that if you have not signed up yet to get the weekly Med fact sheet sent to you, go to nursingschoolsimplified.com/Med Monday, and I'll send it to you every week. We're getting our website ready. It should almost be done. We're going to have everything archived on there. So any of the medications that you've missed, you'll be able to go to the website and have access to those. And I'll let you know when we get that finished. So this week, our medication is hydrochlorothiazide. And if you want to be really cool about it, you say HCTZ. And just as the name indicates, it is a thiazide diuretic. So we're going to jump right in here and we're going to get going on our Med Monday. So let me get this going. There we go. So here we go. Hydrochlorothiazide, or if you're cool, if you're one of the cool kids, HCTZ. It is a thiazide diuretic and an antihypertensive. And this medication is given PO, and it's usually first-line antihypertensive medication. So a newly diagnosed patient with hypertension will usually get this medication. So it works on acting on the distal tubule and the ascending limb of the loop of Henle, and it increases excretion of water, sodium, chloride, and potassium. So I want you to be thinking in the back of your mind, what should we be monitoring, right? So what happened there? Go back. There we go. So indication is idiopathic lower extremity edema. I don't know why that's coming out like that. And edema and hypertension and heart failure. And our contraindication is hypersensitivity to thiazides or sulfonamides, and pregnancy and breastfeeding, preeclampsia, anuria. And we're going to use this with precaution in patients with hypokalemia. So that's low blood, potassium, yes. Renal and hepatic disease, gout, patients with COPD and diabetes, and hyperlipidemia. And we want to monitor that creatinine clearance. So anything less than 30 mLs a minute, we want to give this with precautions. And we want to monitor our patients and give it with precautions with patients with hypomagnesium. So our side effects, or remember, these are non-life-threatening, are dizziness, fatigue, and weakness. And remember that anytime we're initiating any type of blood pressure lowering therapy, patients usually complain about dizziness, fatigue, and weakness until they acclimate to the medication. Irregular heart rate, and that could be from what? The electrolytes, right? Orthostatic hypotension. And remember, we're going to be having hypokalemia, hypercalcemia, hyponatremia, hypochloremia, and hypomagnesemia. There we go. And nausea, vomiting, diarrhea, and constipation, and anorexia, polyuria, erectile dysfunction. Usually with any blood pressure lowering medications, we're going to get erectile dysfunction in men. Hyperglycemia. We will have a potential increase in creatinine and BUN. So we want to monitor those. So adverse reactions, things that could be life-threatening, include pancreatitis, hepatitis, uremia, renal failure, aplastic and hemolytic anemia, leukopenia, agranulocytosis, thrombocytopenia, neutropenia, and Stevens-Johnson syndrome. And just for a reference, I'm going to be doing a podcast episode on leukopenia, agranulocytosis, thrombocytopenia, and neutropenia, so you will understand what those are. And I probably will do one eventually on Stevens-Johnson because it's very interesting. So our nursing considerations include, we want to evaluate for therapeutic response, making sure our patient's blood pressure does come down. We want to assess our lower extremities for edema. We want to assess our patient's blood pressure, daily weight, and INOs, intake and output. And we want to watch our labs. We're going to be looking at our CBC, our BUN, our blood glucose, our creatinine, our liver function test, and our electrolytes. But our electrolytes, they might say chemistry panel, and that does include electrolytes. And we're going to monitor our geriatric patients for SIADH and hyponatremia. And we're going to monitor for a rash, which could possibly lead to Stevens-Johnson's. So our patient teaching, what do they need to know? They need to know signs and symptoms of allergic reaction. We want them to change positions slowly to avoid the postural hypotension. And usually after they've acclimated to the medication, that doesn't happen. They need to take it as prescribed. They should be monitoring their weight daily and notify the physician of any changes. They should avoid alcohol. They should have some type of dietary potassium replacement, and they should have their labs monitored frequently. We need to teach them how to monitor their blood pressure. And for patients who are diabetic, their blood sugars may be elevated. And so that's it for that medication. So thank you guys so much for being here today. I hope this is helpful. I want to remind you that we do have a great Facebook group, the Nursing School Simplified group, and I do a lot of extra teaching inside that group that I don't do on the page. So it's exclusive content. So if you want to join the group, just answer the 3 questions that are there. They're very easy, no pass or fail. It just gives me a little bit of information about your needs, and then we will put you right into the group and get you started. So I hope you guys have a great week and keep working on your dream.